Did you know that about 70 to 80% of women are affected by uterine fibroids in their lifetime? So uterine fibroids are benign tumors of the uterus. They're usually found in the muscle layer, and they can range from multiple sizes, and they can occur anywhere there's muscle tissue of the uterus. There's 4 main categories of symptoms that we tend to see. Number 1 is abnormal uterine bleeding. Number 2 is pelvic pain. Number 3 is infertility, and number 4 is what we call bulk symptoms, which can cause some urinary symptoms as well as even constipation, since the uterus is very close to the bladder and the rectum. So here's a visual of the types of fibroids based on their location within the uterus. So the first one is subserosal, which is on the outer wall of the uterus, and they typically tend to cause bulk or pressure symptoms. The second type is the intramural fibroids, and those are located within the muscle walls of the uterus, and they can cause heavy bleeding or pressure symptoms. Next are the submucosal fibroids, which are essentially inside the cavity, and they typically tend to cause very heavy bleeding. And finally, we have the pedunculated fibroids, which are essentially on a little stalk on the exterior portion of the uterus. So here's a visual on how to kind of think about the size of your fibroids. Fibroids are usually described in terms of centimeters, and depending on the size and location of the fibroid, that will give you the type of symptoms that you might feel. So one example would be a 1 centimeter fibroid is about the size of a blueberry. A 3 centimeter fibroid would be the size of a strawberry. And an 8 centimeter fibroid would be about the size of a peach, and so forth. So a lot of times patients think when they have fibroids, their only option is a hysterectomy. But in reality, we've come a long way, especially in the last couple decades, with how we can treat uterine fibroids. And there's actually 2 uterine-sparing fibroid surgeries that I want to tell you about today. So the first one is called a CESA, and it's a procedure that we can perform laparoscopically, and essentially we take the probe directly to the fibroid while visualizing it on an intraoperative ultrasound, and we're able to shrink the fibroids, and it goes from the consistency of about a baseball to that of a marshmallow. I've had great results with this procedure, and I'm excited to be able to continue to do that procedure for patients that are good candidates. The second procedure is called the Sonata procedure. And essentially what we do is we put the Sonata handpiece through the vagina into the uterus and watch directly with ultrasound at the same time. And we're able to deliver the radio frequency energy to the fibroids in order to help them shrink and also to alleviate your symptoms. Depending on the size and location of where the fibroids are located will help us determine which procedure is right for you. If you have questions or want to see if you're a good candidate, please ask us about it today.